Hi, my name is Michael Green. I am MD. I am a board-certified OBGYN, and I'm the Chief Medical Officer of Winona. I'm here to answer your questions. So we got a question that was asked that was, is it okay to take hormone replacement therapy after a complete hysterectomy? The short answer is absolutely. Hormone replacement therapy works great after a hysterectomy. If you've listened to my other videos, you know there's going to be a longer version of this answer. And I want to start with this terminology of complete hysterectomy. Unfortunately, there's a mismatch between the language that the medical profession uses in regards to what type of hysterectomy somebody's had, as compared to what the lay community, the sort of normal patient, often uses as far as language. And so whether someone had a complete hysterectomy, a partial hysterectomy, or a total hysterectomy, these words are important and have real meaning, and so I want to make sure that we communicate correctly. The medical terminology for hysterectomy is partial hysterectomy or a total hysterectomy, or sometimes it's called a subtotal hysterectomy instead of a partial hysterectomy. Hysterectomy itself is removal of the uterus. We usually also remove the cervix, and so a total hysterectomy is removal of the uterus and the cervix, whereas a partial or a subtotal hysterectomy would be removal of the uterus, but leaving the cervix in. It has nothing to do with the ovaries. Removal of the ovaries and the fallopian tubes are really a separate procedure and have a separate name. So removal of both ovaries would be a bilateral oophorectomy, and removal of both tubes would be bilateral salpingectomies. And so if you remove both ovaries and both tubes, you would have a bilateral salpingo-oophorectomy. That's the fancy medical term for that. Unfortunately, there's this lay language that a lot of patients use and a lot of people that aren't medical personnel, and that is this idea of a complete hysterectomy. And so when someone asks me about a complete hysterectomy, I'm never quite sure whether they mean uterus and cervix or they mean uterus, cervix, ovaries, and tubes. And so I think a lot of times when patient says complete hysterectomy, they're talking about having their ovaries removed as well. So that's a big explanation just to talk about the linguistics and the language, but it's actually important so that we communicate clearly. Whether you've had just your uterus and your cervix, uterus, cervix, and ovaries, your uterus, cervix, ovaries, and fallopian tubes, the whole ball of wax removed, either way, hormone replacement therapy may be a very appropriate treatment and an excellent treatment for you. If you've had your uterus removed, whether you've had your ovaries removed or not, you really should not need progesterone, because progesterone is primarily used to protect the uterus, and since the uterus has been removed, it no longer needs protecting. And so hormone replacement therapy for someone with a hysterectomy usually does not include progesterone. If the ovaries are removed, then patients typically have a much harder time with the symptoms of menopause, with the symptoms of the menopause transition, because that transition basically happens overnight instead of happening gradually. And it can be really hard for people. And in that case, they typically need a bigger dose of hormone replacement therapy. And so it's important for us to know whether they still have ovaries or not so that we can dose the medication properly. But whether or not it was just the uterus or the uterus and the ovaries, hormone replacement therapy is a great treatment and can help a lot of these symptoms that women suffer with after hysterectomy.